Hello, my name is Lillian Schmitz, and the date is April 25th of 2021. On the back side of my note card here, I just have some notes to follow along with for this presentation. So the organ system that I chose to present on is the endocrine system. So a specialist in the endocrine system is called an endocrinologist, and they study, diagnose, and treat disease and disorder of the endocrine system. So their role typically consists of helping restore hormonal balances to patients that have hormonal imbalances. Common diseases an endocrinologist will manage include diabetes mellitus and thyroid disorders. So the organ of the endocrine system that I'm going to focus on is the pancreas, specifically the endocrine pancreas. The pancreas is tucked in the first fold of the duodenum within the pancreas, and the pancreatic head is going to be superior and medial to the duodenum. The body and the tail of the pancreas extend laterally and inferior, they're inferior to the stomach. The entire pancreas is going to be inferior to the stomach. So the pancreas is divided into the pancreatic head, body, and tail, as I said before. It is made up of lobules with a centralized pancreatic duct that runs through the entire organ, and it branches into accessory pancreatic ducts. It is also both an exocrine and an endocrine gland. So the exocrine pancreas makes up about 99% of the pancreatic volume. This portion of the pancreas releases enzyme-rich digestive fluids. The endocrine pancreas, this is the part that I'm going to focus on for this presentation. This is the part that makes the hormones and affects the endocrine system. Is composed of pancreatic islets, and these are spread throughout the entire organ. So these islets contain 4 types of cells, and those are alpha cells, beta cells, delta cells, and F cells. All of these cells are going to produce hormones that are associated with the endocrine system. So the alpha cells are going to produce glucagon, which is going to increase blood glucose levels. And then the beta cells are going to produce insulin, which are going to decrease blood glucose levels. Delta cells are going to produce somatostatin. This inhibits the production of glucagon and insulin. And finally, F cells are going to produce pancreatic polypeptide, and this inhibits gallbladder contractions and also regulates the production of some of the pancreatic enzymes. So these 4 hormones aid in digestion and nutrient absorption, as well as metabolic operations throughout the body. So the alpha and the beta cells in the pancreatic islets, they work with one another to regulate the blood glucose concentrations independent of the nervous system and other endocrine glands. That is the endocrine system and my focus on the pancreas. Thanks for listening.